This
putting that
conference
website?
will now be recorded.
I will definitely do that. I'm doing that now.
Thank you. All right. So just for the recording, I was telling everyone about patientadvocate.org. It's a website that's available to all patients. If you need any kind of assistance, you can reach out to them and see if they can help. And then the other thing that I wanted to share with you is this year, FSR is doing a lot of cool things. And one of those things is this Saturday, they're doing Qigong, and that's free online. And I am so sorry, my brain is forgetting how to find the link for that. Oh my goodness, that's what happens when I don't feel good. I'm so sorry, you guys. But I'm really excited about some of the things that FSR is offering. Oh, sorry, Leah, it's Foundation for Sarcoidosis Research. And I apologize. That was the very first organization I found after I was diagnosed. And so my brain just thinks that everybody that finds me already knows about them. So I apologize for assuming that. But I will try to share those links that also. Yeah, so Kathleen put their website up there. But they had some meditation that you could do, but I missed out on that and I didn't share it with anybody either. But now the Qigong I know is this Saturday, and then they're doing Sarc socials throughout the year. And you can probably find all this stuff on the website as well if my brain doesn't allow me to share the links. But that's just what I wanted to share with you before we go around and check in. And oh, Yvonne's here. Let's see who else has got here that I didn't notice. We got Yvonne and Elizabeth. Elizabeth was here when I arrived, but her camera's off.
Who's Yvonne?
Hi, Yvonne.
Hi.
Who's that last one? JG.
That's me, James Cloystein.
Oh, hi. Hi there. Okay, so let's see. So we're gonna go around, and I'm really bad about the introductions. I usually make them take the whole hour. So I'm gonna try to be good today, and we're gonna try to give ourselves 30 seconds to do an introduction. So I am, yeah, I was looking at the minute hand at first. Don't do that, because then you'll be doing 30 minutes for your introduction. So I'm gonna let you guys self-police on the 30 seconds though. So I am so sorry. My brain is only half here, and there's no second hand on my watch, and I don't know what to do with that. So I'm just gonna go.
I was gonna say, do you want me to set one up? I can do it on my phone for you.
Oh, that would be great, Spencer. Make kind of a game of it.
Sure.
Okay,
so,
tell me when to go.
Ready and go.
All right, my name is Susie Torres. I am an ambassador with the Foundation for Sarcoidosis Research, and I am also a moderator here in the online support group. And I was diagnosed in 2017, but I've been chronically ill all my life. And yeah, I am really tired of doctors and needles and PET scans. I had a cardiac PET scan last week and regular PET scan today, and that's why I'm feeling kind of crappy and my brain doesn't work 100%. But yeah, so that's all I've really got to say right now. Thank you.
Perfect. Spencer. 28 seconds. So, woohoo.
All
Okay.
right. Go ahead, Spencer. You take charge.
So, I'm Spencer. I'm one of the youngest patients ever diagnosed at National Institute of Health. I was diagnosed when I was 4 years old. They thought I've had it since 6 months, and I've been dealing with it my whole life, so I know nothing different. You'll probably see me on the Sarcoid page. And if you ever need somebody to reach out to, I'm always somebody you can. I've been through most of it, probably all of it at this point, so once again, if you have questions or comments or concerns about it, let me know. That's it for me.
Thank you, Spencer.
Yeah.
So I guess
Okay.
I'll go next. Is that all right?
That's fine.
Thank
Go
you.
ahead.
Hi, everybody. My name is Kathleen. I'm an ambassador for the Foundation of Sarcoidosis Research for the past 6 years, as well as a moderator here for the National Sarcoidosis Online Support Group. You can also reach me on Facebook. I answer pretty quickly. If you know my phone number or you get it from there, please, if you have a question, reach out to me. And I have had sarcoidosis for the past 12 years, and it's everywhere except for my eyes and my kidneys at this point. That's all for me.
I'll go next. I'm Brian Stein. I'm from Irvine, California. I've had sarcoid for the last 26 years. Been pretty dormant for the last 5 years and only started acting up in the last 5 years. So it's in my lungs and in my mediastinal lymph nodes. So on prednisone at the moment and trying to see what I can do next.
Well, welcome, Brian.
Thank you
Yes,
again.
thank you, Brian.
So, Susan, would you like to go next?
Oh, we can't hear
Susan, I
you.
think you're unmuted. You're
Unmute
on
yourself.
mute, Susan.
There we are. Better? Okay. Susan Bassi, I'm from New Jersey. I'm new, just signed up for the support group, so this is my
Look in the pocket
first
inside.
visit. I'm new to being diagnosed only in 2019. I've been sick for though
They're
about 4.5
thin.
to 5 years.
They're real
So
thin.
the diagnosis, mostly
They gotta be outside.
pulmonary, rheumatoid issues, and I'm in the middle of cardiac possible diagnosis right now with some neurological stuff too.
It's a book.
Well, definitely welcome, Susan. Thank
Yeah,
you.
welcome. Yeah, I hope you find some support here. I'm sorry that you're dealing with that.
Thank you. And I probably got past my 30 seconds, but I just wanted to say,
Okay.
since you're both
Be
with
in
the
the
Foundation
zipper.
for Sarcoid Research, that I was
Yeah.
just selected for their patient advocate committee. So
Oh, yay!
just started out.
Yay. Congratulations.
Thank you.
Yes,
That is
congrats.
wonderful.
Book.
Okay, when we're doing the introductions, if I could ask everybody that's not speaking to mute themselves, and then it'll be easier for us to hear. Who wants to volunteer to go next? Did you raise your hand, Leah?
Like, hey, go ahead, say your name.
Hi, I'm Jaden.
So this is Jaden. I'm mom. So Jaden was diagnosed in May of this last year with sarcoidosis after he had a presentation, swollen lymph nodes in his neck down, mostly just his left side of the body, and he lost his central vision. So he was diagnosed with uveitis also. We've gotten his vision back, but they're still trying to find good meds to stabilize him. Yeah, I guess that's it right now. We're looking for good support groups, some for
So,
kids, teens.
so if he ever needs somebody to reach out to sort of close to his age and that's dealt with it, have him reach out to me. I've done it all. I've done prednisone, Remicade, Humira, all of it. And I also have uveitis and hence the glasses. But if anybody, this goes for anybody, if you need help to, get something going, let me know. I will talk you through what I've been through in the past. So
Thank you.
Welcome, Jaden. Okay, let's see. Yvonne, do you want to go next?
I'm Yvonne from Fredericksburg, Virginia. I moved back to Fredericksburg. Ambassador for FSR. They recently did an article in the, I was looking for the book. I can't think of the name of it, but FSR sent my name in and they did an article. I can't think of the name of the book this month. and they're supposed to be sending me some. And when they do, I will let you guys know. Do you know what it is, Susie? Do you know
No,
what the name of
I'm sorry.
the
I can
magazine
remember
is?
I remember the post on Facebook, but my brain's not at full capacity tonight, so I apologize. I can't remember right now.
Mine either. Okay.
But thank you.
All
All right.
right.
Wendy, do you want to take 30 seconds to introduce yourself?
I am Wendy Schleier. I live in Rochester, New York. I have neurosarcoid, lymph node sarcoid. It's probably in my thyroid, what my thyroid doctor told me, but there's nothing you can do for it. And it might be in my liver. That's it.
That's enough, right? That's a lot to deal with. Thank you for sharing. Let's see. Elizabeth, would you like to go next?
Hi, everyone. My name is Elizabeth. I'm in Wisconsin, and I was just diagnosed over the Christmas holidays. And I'm just learning about it. I'm on medical leave right now. I'm a teacher, and I kept thinking it was because of all the pressure that was on me with teaching, and found out it was more. So this is new. I'm just going to sit here and listen to you guys tell me all about it.
Welcome, Elizabeth. And yeah, I'm sorry that you had to join this club, but you are very welcome here and we'll do our best to support you.
Thank you.
Okay, so let's see. I don't know why I can't see the names of the people that don't have their cameras on.
I have James is also here.
Okay, James, do you want to take your turn?
Sure, I'll be quick. I've been with this wonderful, I was just going to tell Elizabeth, I've been with this group a year and a half, and I have learned so much from them. It's really a wonderful resource. I'm one of the lucky ones. About last summer, I had a PET scan, and my sarcoidosis in my heart and my spleen and one of my ribs is gone. But what I learned from this group is it's just dormant. So I want to continue to work with this group and help others and track my own progress. But my AFib has started to go away completely thanks to the sarcoidosis being gone. So I think that's 30 seconds. I'm done.
Thank you, James.
Yeah, thank you.
There's a Liz as well, Susie.
Okay. Liz,
Hey,
do you want to introduce yourself?
hi, this is Liz. I live in Maryville, Tennessee. This is my second meeting with y'all. And I was diagnosed with sarcoidosis in 2016.
Thank you, Liz. We're glad to have you. And I love that you're from Maryville, Tennessee, because the only person I know from there is my daughter-in-law. And I'll probably tell you that every time.
Thank you.
Liz, we're in Tennessee too.
Oh, yeah. What part?
We're in Clarksville.
Okay. I'm not sure where that is, but is that near Nashville?
Fort Campbell.
Okay. Thanks.
And Susie, there's a Shamrock Girl.
Shamrock Girl, is that your real name?
I guess they're not there right now.
Okay, then. Well, I was thinking about I had ideas, and now that I'm trying to talk about it, it's a little bit harder to verbalize. So I guess I was going to use what I've been going through as a platform to launch off of, to talk to. So maybe I'll just be like, I'm the one with the problem this time, and you guys can help me, right? So I have been dealing with sarcoidosis, and so January 2017 is when the big part of my journey started. And I'm going to get emotional. I really wanted to just go to the doctor and get a pill so I could go back to work. And of course, you all know there isn't such pill. And like Kathleen, I'm allergic to so many things that I have not had a lot of luck with treatments. And I've just found myself in a place lately that I don't want to do my IVIG, and I'm short-tempered with medical assistants, and I don't want to see doctors, and I'm sick of needles. And I don't want going to the doctor to be my full-time job anymore. I want a different life. I want to quit this job and do something else. But we don't get that choice, do we? I mean, yeah, I don't know who chooses when it goes into remission. It just seems like the lottery. But I haven't won that lottery. And so I guess let's go around again. And I'll let you guys give me tips if you want to for how do you deal with that? How do you keep going every day when you're dealing with this stuff?
So one of the ways I tend to deal with it lately is through journaling. I take probably 10 minutes every day, more often at night, right before I'm about to go to bed, and I just write everything down. You know, basically anything I think of, it spills onto the page, be it good, bad, or ugly. I just let it go, and that's kind of my venting process. And then one of the things that I've always found useful is complex case managers. I know I talk about that a lot, but those will help more and more than you will ever know. I got lucky and got a good one. All of them are good. So that's how I would deal with it. That's my personal advice.
Thank you, Spencer.
Spencer, I have a question for you that I'm sure if I'm thinking it, other people can. So I know you've mentioned complex case manager a few times. Is there a fee to that, and how do you find one in your immediate area?
So the way I found one is I have Kaiser Permanente. You can always call their member services line. It's part of being part of KP. There's no fee to it. There's nothing to it. But they're the ones that, on your behalf, will always talk to the doctor. And I found that mine translates it into plain English for me instead of giving me all the hospital jargon. And that's taken a load off my shoulders of trying to force Dr. A to talk to Dr. B and Dr. C to talk to all of them. The complex case manager basically compiles all that, so long as you tell them, hey, as long as you tell the doctor, hey, forward it to this person as well. The notes you've taken, forward them that way. And like I said, through Kaiser Permanente, it's part of it. You just call your complex, or you call member services for those in Georgia or elsewhere. I think Shasta might know, but I believe there is a site that will also put you in touch with complex case managers should your insurance not be able to do that.
Hey everybody. So to answer that question vaguely, there are a couple of resources I would definitely, I'm just getting home, y'all. So give me a second. If you give me by the next meeting date, I will have those couple of websites on where you can find complex case managers, where you can find an advocate for not just only your specific disease and illness, but for others as well. Kathleen, we talked about this at training last year too. So that's one of the websites I'm going to use, definitely. So there are a couple of different places. Also, you can ask for a case manager at your particular doctor's office, and they'll help you with the complex case manager for an overall. They'll what they'll do is they'll sign you up. They'll take on your case, and then they'll sign you up, and then they'll relieve themselves once they find you somebody else. So you can definitely ask your primary care doctor. Definitely, they have a case manager that's in their office, and so they'll get you hooked up, and then they'll take the reign, and then they'll pass it on. So yeah.
Excellent. Thank you, Chasta, for that, because I think we all could use those websites, if you don't mind. So
Absolutely.
the next meeting.
So what I'll do is when I find them, if everybody is in the group, once I find the websites, I'll go ahead and post them in the group.
Thank you. So Susie, I think I'll continue if that's all right. Thanks. So as I stated, I have had sarcoidosis.
And Susie,
Oops. I've had it for 12 years, the sarcoidosis, and it's slowly taking over my life. So similar to Susie, I too am in not necessarily a very good place, but by learning from all of you, some of the things that I've been doing is I started a blog and I actually published it. I thought I would not, but I did. Not all my friends have connection to it. I feel that the people I'll do this, the normal people don't understand what we go through. How could they, honestly? Okay, so they broke an arm. Yes, it was painful. Yes, they were screaming in pain, but this is every day for all of us. And it seems like every other day I feel like a whack-a-mole. I come out of a hole and then all of a sudden, bam, you have cardiac sarcoidosis. Okay, bring up my head, bam, you have this. And it just keeps happening. So yes, of course, my family knows about it. Can they really understand? They can't. And I'm not one of those that wants, oh, Kathleen, I'm so sorry. I hate that. All right. So I stopped working last year. I've been trying to get disability. It has not been approved. So that's another frustration in my world. And this is what everybody's gone through as well. So I'm also a ballroom dancer. I've also started a group called Roll Call Wheelchair Dance. So it's for people who are seated. They're called seated partners, whether they be in a wheelchair or just can't walk properly or their legs are not that strong. I try to do upper body. However, because of the sarcoidosis, my sarcoidosis is taking away that too. I'm 53 years as a dancer. That's who I was. That's how I got my frustrations out, my happiness, my sadness, my pissed offness, all of that. And I'm not sure where I'm going yet, to be 100% honest with you. But I do know with this group, some Tuesdays and Thursdays, I feel like, oh God, I really can't do it. And once I come on and I see all of you, it's like, oh, it validates me. It's like, okay, you know what? You're good for another week or two. So, and then I know I can always reach out to Spencer or Chasta or Yvonne. I've been hitting up Yvonne quite a bit. Susie too. I can just pick up the phone and call Susie, and I don't know. It's just, I'm in a weird place too, Susie. I'm with you. I'm tired of doctors. I don't want to do the Remicade. The Remicade, I'm not feeling it. I feel no different. I've had 4 doses. I feel sick. I have headaches. Now I got to take 2 more pills for the headaches so that I can sleep. Oh my God, it's just I feel like a mess. So realize that is part of this. But I promise you, we all come out in the end, because we're on Facebook together and we see our struggles. So Susie, I'm always there for you, and I want to go punch out the doctors too. I'll come with you. I said to Susie before we even started, guys, I wished I lived closer to her. I wish we all could be in one commune and help each other and bolster each other up, every day, because, okay, Spencer might feel horrible today and I'm okay today. So come on, Spencer, what do you need? I wish we were that close, because I know that we could work together. So, but realize that we are here. I mean, The moderators here care about everybody. Susie's a moderator, Yvonne's a moderator, Chasta's a moderator. And there's so many others that you haven't met yet. So realize we are here with you. We are also patients. So what works for me or what works for Spencer with the Remicade may not work for me.
I give it this because I will admit that Remicade is no fun. I got lucky. My infusion nurses said, "Hey, we can decrease this from 2 hours to 1." So it's only an hour in a chair, but I'm still out for 3 days. After Remicade, I'm bedridden for 3 days, and it's no fun. So I will admit that.
Okay, y'all are giving Jaden like this little oof. They're trying to put him on Remicade, and he's like, "I'm not taking that shit." And I'm like, "Yes, you're gonna do whatever they tell you. You're gonna do." So now y'all gotta help reverse the here now.
Well, let me say
Battling with
this.
a 15-year-old here. Somebody help.
Yeah. Okay. So my Remicade story is different. I've been on Remicade since 2008. So that's right at what, 12 years now, to almost 13 years. And Remicade has done wonders for me. Remicade is what knocked me into remission. So it knocked me into remission, and of course I get the pre-meds, and my treatment lasts 2.5 hours. We tried the whole hour thing, didn't work. All my veins blue. All that kind of stuff like that. So after we finally got a consistent, everything was fine. The 2.5 hours works well for me. With the pre-meds, I sleep the rest of that particular day, and the next day I'm still kind of groggy. But after that, it's like the Energizer Bunny. I just keep going and going and going until it's time again. So the Remicade has done amazing for me. I'm sorry that it's everybody else doesn't have that story. My hope and prayer is that everything that works for me works for everybody else, but because we are snowflakes, it just doesn't happen that way. But don't be discouraged. Again, like Kathleen said, what works for.
Can I ask you something? I was on a generic Remicade. Were any of you on straight Remicade or generic? Could generic be worse than the Remicade, or?
Actually, Remicade is the generic, and Infliximab is the proper one. Is the real one.
I was on the Intercept.
Oh, you were on the third phase of the Infliximab.
I didn't even know
so
that.
Infliximab is the original drug, and then it's different phases of the Infliximab. Remicade being one, the one that Wendy did, and I think it's like 3 more. I have to do proper research to that one. So yeah, it's different. It's different Infliximabs, and Remicade being one of those. So yeah. They didn't ask me about that one, Wendy. He just went straight to Remicade, and that's what I agreed to.
Yeah, whereas
They told me it was Remicade, but then I read the bag and it said Intercept, and then I looked.
Intercept is Infliximab.
And Infliximab is what I was getting, not just.
Yeah.
I just call it Remicade. It's a heck of a lot simpler. So
Jaden, here's a question real fast.
Okay. Hey, Jaden.
Yeah, ask her. Come on, this is your stuff.
What about the first time that you took it?
Okay, so the very first time I took it, I had a high dosage of it because of how aggressive my sarcoidosis was. So they're gonna give you your first dose based off of how aggressive your sarcoidosis is affecting your body. So what they're gonna do is they're gonna probably put an IV into your arm. They're gonna give you Benadryl and Tylenol for your pre-med so that nothing happens while you're while they're injecting the drug into the IV into your veins. You're probably going to fall asleep because you're probably not going to be used to that much Tylenol and Benadryl at the same time. So you're probably going to be a little groggy and a little tired. But trust me, it will wear off. I say give yourself a day or two because you're so young. Give yourself about a day or two, and you'll definitely bounce back quicker than this 34-year-old. And you'll probably definitely bounce back quicker than Susie and Kathleen. So you're going to be fine. Trust me. Because you're going to be around a whole lot of nurses. So don't be afraid. Take you a lot of reading material. Take your games. take your Nintendo Switch, all of that good stuff. So you might be there for a little couple hours. So yeah, you'll probably be a little tired while you're, once the Tylenol and Benadryl starts to, set in and stuff, you're probably gonna get, groggy in your eyes, and you might drift off to sleep and stuff like that. But you're
Doze
gonna be
off.
fine. Yeah.
Drink lots of water.
Yeah, drink lots of,
Yes.
definitely drink
Yeah.
lots of
Oh, yeah.
water. Lots of water. So what I
Yes.
do with that, if I know my treatments are on Mondays,
Before you go, definitely.
yeah, my treatment is usually on Monday. So all day Sunday, I'm drinking water. All day Sunday, getting a whole lot of water in my system. And even on Monday morning when my treatment happens, I'm drinking all water. You can take snacks. I know my treatment place allows us to bring snacks and stuff in, so you can eat while you're on it. It's not going to affect anything. So if you get hungry, hey, take a snack, and stuff like that. So yeah, you may feel a little groggy afterwards, but then again, you being young, you might want to go run a marathon. I'm not doing all
Yep.
that.
They
So
give you yours on the cancer ward too.
Yeah.
my treatment center, they do it all. They do chemo, they do dialysis, all that kind of stuff like that. But if they also have private rooms at my treatment center.
Yep.
So if I want a private room, I can just ask for a private room. But because you're his mom, a lot of places are going to give you a little private area because it's just the two of y'all. And if it's his first time, they're probably going to give him a private area.
Yeah.
Because they're going to treat him at the Vanderbilt Children's in Nashville.
Oh
And
yeah, he's going to be fine. Yeah.
yeah, so I was just I was thinking, I'm telling his teachers and stuff, I'm like, he'll be on Zoom. Don't worry about it. It's going to be okay. You're going to do school. You better get up and go. Like,
Well, mama,
So
you can take the Chromebook if you want to, but you may be the one doing the work instead of him.
You're gonna
So-
be asleep.
So, speaking from somebody that was his age, so a little bit of my story is I was on Remicade for a little bit, and then I had a change in rheumatology doctors, and they swapped me from Remicade to prednisone. It's a prednisone methotrexate combo, and then I went back to the rheumatologist that I originally had that put me on Remicade, and he's like, "Why in the world would they put you on prednisone again?" And my little kind of horror story is I was on prednisone from 8 years old to about 16, and it did. For those of you who are on prednisone and know, it is no fun. I think Frank calls them the devil's Tic Tacs. So, Remicade is, well, yes, I'm out for 3 days. Everybody's different, and especially young. I was, when I was on it at 15, I was running through walls. I felt indestructible, and now that I'm a little bit older, at 25, I'm like, okay, no, this is not the same thing. And then I know my mother, who basically helped me through this when I was real young. She basically, we didn't let this become like a disability. We treated it as normal, but she did have a spacing on the number. I think it's a 504 plan that basically says teachers have to give you special accommodations like, a cushioned seat if you can't sit for a long time, extra time on tests, and all that stuff. So that's what I would recommend for you. Obviously, I'm not a doctor, but that's kind of my story about Remicade. So it's not bad, trust me. It's a day off school. That's what I'll tell you.
Well, and I definitely agree with Spencer. With the school district here, they have those accommodations also with, and you want to check your job too, Mama, to see what accommodations they have for you when it comes to the FMLA and all that kind of stuff like that. But with Jaden's thing,
my hands are super full. I got a husband with a traumatic brain injury and severe
okay,
PTSD.
gotcha.
And now I got this. So I'm at home anyway. So
Okay, yeah. So just check. You can call the school, the principal, and if he doesn't know directly, you can definitely call down to the school district's office, because they definitely have it to where he can be set up for all of that. It won't count against him or anything like that.
Yeah, he's got an IEP right now. We just did. They pretty much pushed it forward because everything here is dual and traditional. So he's at home. But I mean, the school's been great with working with pretty much
Some
everything.
teachers.
It's just hard because of the uveitis and being virtual, like, and nothing stabilized, and he's still on prednisone, and he's on Cellcept, and we're doing Humira injections weekly, and he's still relapsing, and it's back to the doctor and to the
Do you
rheumatologist
have a Voc Rehabilitation Center near you?
for.
Vogue Rehab. And the reason why I say that is because the Vogue Rehab here is a nationwide sector. And what Vogue Rehab did for me when I had the real bad uveitis that set in, they hooked me up with tools, materials that were free of charge, and stuff like that. So that he would be able, so he has the Chromebook. I'm assuming y'all use Chromebook for virtual school.
He uses, well, no,
I use my own laptop.
yeah, I
You
got
do,
a,
Because those are the too small to read the words.
too
right?
small.
Gotcha. So
But
what
they
Vogue?
the Eye Institute, or not the Eye Institute, what is it? The something in Nashville. He's got Miss Henderson. She's like the eye person for the county,
Yeah.
and she does his stuff, and it's supposed to be setting up everything that he's supposed to need and go back and forth. It's just everything just takes time.
Yeah, and see, what Vogue Rehab would do is they would give me everything I need to enlarge the words. They gave me my own personal laptop, that would, with the programs and stuff downloaded, so that if I needed to make the words bigger on the screen, they would do all that. The magnifying glasses, the lap desk, they made it very, very, very comfortable for me with the illness. So Voc Rehab, that can be a second option for you all. And if I need to get you the information to the national sector, I definitely will. That's not a problem at all.
That would be awesome. It's just hard because nobody here really understands what's going on with him. And because he's a kid and they're like, well, this isn't normal for kids his age to have this. And so what does he need? And you're like, okay, well, I need you to give me larger fonts, well, does he need everything printed? No, not necessarily. But when, he does need something printed, I need to get something printed. And, he can't see today. So you're going to have to do auditory. So it's like they're trying to manipulate, and everybody's playing a new game this year that nobody's ever played before, and nobody knows the rules to this virtual school game,
Right. Now, where are you all located?
We're in Clarksville. We're in Tennessee.
Tennessee.
We're like
Okay, gotcha.
an hour from Nashville. So,
Okay.
so they're trying to play their virtual school game, and we're trying to play this sarcoidosis game. And, it's like juggling with 4 hands, and I only have 2. So it's
Gotcha. Totally understand.
yeah. But yes, if you could send me whatever information you have, that would be awesome. And I do have
And
Absolutely.
it gets to the point, and it gets to the point too where when you go into a doctor and they're skittish about their treatment, you have to start treating yourself. You have to start telling them what you need and what tests you need run, what hospital or clinic you need to go to, because they don't know, and you know more than they do.
Well, that's just
So
it, Mr. John. Right?
you'll have to start treating and diagnosing yourself.
Yeah, they just don't
And
know all the symptoms, and they just have no idea. I do have a question. Has anyone been on Imuran?
Mhm.
which one was that?
I was
I was on
Imuran?
Imuran a
Yes.
I
long
was
time
told
ago.
by Dr. Judson
Yes, I have.
that did not break up the granulomas.
Imuran.
It didn't.
Yeah,
I don't
my
know.
pulmonologist wants to start me on that with my lymph nodes that have gone bigger, even though I've been on prednisone.
Well,
They have.
I was on it, and
Sorry.
I think she's having issues. Her phone keeps breaking up.
Hey, it didn't work or did work? I don't know what she said.
Yeah, Yvonne, we having
I
issues
was on
hearing
it
you.
for 5 years, and it eventually, my phone, and it eventually burnt my sarcoid out.
Oh,
It didn't, who, me?
I
Yvonne,
didn't.
did you
Okay, let me see.
say that it took it out?
Okay. It burnt mine out. It didn't put it in remission. It completely burned it out like you would a fireplace. And that was in 2013. The only problem I have now with sarcoid is what it left behind. And
The damage
excuse
is that's what
me,
you're talking about, right? Yeah.
an AFib that it caused.
Hmm.
That's the only problem I have now. But as far as the sarcoid itself bothering me, it does not.
Interesting.
So the that when they took me off of prednisone and put me on the Imuran, that helped tremendously.
Okay. Thank you.
I had 40% of my lung capacity left. I had cardiac sarc. It had started on the skin. A neurological, slight neurological. It had just started before it burned itself out. So therefore, you know, like my fingertips, a couple, and my right arm are numb a little bit. But that could have come from I had breast cancer 6 months after that. So after I had that, it could have been the neuropathy that caused the numbness, they said. They're not sure which one did. So that was it with me. The prednisone, though, was messing up the bones and the muscles, and everything was sore. I could hardly walk. I was on oxygen, and they still want me to sleep in it at night because of the AFib. But other than that, I'm doing pretty good. Now it's easy for me to get pneumonia. If I get a cold or somebody around me, you know how we are, it's pneumonia to us. But even in the last, I'd say, year, I haven't had pneumonia. So I guess I'm getting away from that also.
Yvonne, do you think that because we're all kind of like shielding that you also didn't get pneumonia? Because this is
And
the
I was
first
diagnosed in
year that I have not had pneumonia.
1993.
Yvonne,
So, oh,
I'm sorry. Yvonne, you faded out. Spencer?
so I think I could kind of answer that maybe a little bit. So I get pneumonia just about every year because once you have it one time, you're more likely to get it over and over and over again. It seems to be a yearly thing for me. Crossing my fingers it won't happen this year, but
And
I
Susie, in answer to your question that you asked, what I did to help me through, because at one point I had just given up, and I said, I don't even want to live.
Spencer, what were you saying?
so with pneumonia, it like I said, once you get it once, you're bound to happen. You're bound to get it again. Um, Best thing I've ever been told was take vitamin D. Um, and vitamin D has been kind of a lifesaver. Um, but if you talk to your rheumatologist and say, hey, to avoid, being sick more often, can I take vitamin D? And the biggest thing I always say is you got to be your own advocate. You will always know more about your own body than a doctor will. So if you know
I
something's
need
wrong,
something from the store, or somebody goes to get it. I do not go out. My doctor's appointments are virtual. My doctor's appointments are virtual too.
and
I
I think
just
that's
won't go.
kind of everybody, yeah, with the virtual. Now I'm a little bit more adventurous, maybe because I'm young. But I've had a lot more in-person appointments, partly because Washington State is allowing in-person appointments now. But for my therapist, my rheumatologist, my oncologist, basically all my doctors I can see in person. Now, my rheumatologist and I have an understanding that it's in person every 3 months and over the phone every 2. So I see him pretty regularly. And for those who their doctors may not know a whole lot about that, have them get in touch with Dr. Ragu at UW Medicine. He is the sarcoid lung specialist, so he knows how to treat it. I'm lucky that he's up here with me. I don't see him, but all my doctors have either studied under him or talked to him regularly.
That's awesome, Spencer. I just would caution about the vitamin D. You want to make sure that you know how it works with your body. Because for me, my endocrinologist put me on a high dose of vitamin D, and almost instantly I had kidney stones. My
Yeah.
body does not process vitamin D and calcium properly. So I have to be very careful with those.
Does anybody take Bactrim to avoid the pneumonia?
I'm allergic to any of those, the Septras, the Bactrums.
I'm not, I didn't do Bactrim. I do the pneumonia shot every 3 years though. So I'm actually scheduled to get it on February the 4th, but since starting that pneumonia shot, I hardly ever get the pneumonia period.
I haven't taken Bactrim, but they were going to put me on erythromycin because I don't build titers to the pneumonia, the pneumococcal. So even with the vaccines, I still don't build any immunities to it. So, but they can't do that until I get cleared through cardio because I had a abnormal ECG.
I was going to say about vitamin D, it's always smart to get tested at least once a year to see where your vitamin D level is, because you don't need to supplement if your vitamin D is high enough. And high enough probably means somewhere between 45 to 60. Now, a lot of people are low. And when you find out how low you are, then you can add, and it's safe to add huge amounts, like 10,000 a day in some cases. You can do that, but you should do it always with your doctor. And also, if you're taking vitamin D, check your levels. I mean, I've come down, when I first got diagnosed with cancer, my level was about 18 or 19, and I took, I think initially 2,000 a day, and now I just take a maintenance dose of, I think it's 400 a day. But what you need to test for is, it's called vitamin D hydroxy 25, or vitamin D3 hydroxy 25. And it's just in the regular panel. So it's probably worthwhile everybody just checking. And then of course
Yeah.
you have the other issues like Susie's issue, which is another complication, but don't just dive in and
Yeah.
start taking vitamin D, right, Spencer?
Of course, yeah. Always check with your doctor. I'm not a doctor. I'm not a medical professional, and I don't claim to be one. But I of course talked to my doctor, and he gave me the green light for it. So.
Right. And I was just going to ask anybody who is not receiving a reminder for this group in their email, and if you would like to receive a reminder from the group, if you just put your email address in the chat window, we'll make sure that you get that reminder before every meeting.
Thank you, Rick.
Thank you.
Just a quick hello to Senor Rick. Rick is the gentleman who gives us this lovely room to meet twice a month. So everybody say, hey, and thank you.
Thank you, Rick.
Thank you.
Thank you. I'm glad it's helping people. I love it when I come in and I see all these faces. It's wonderful.
It really is.
I wanted to add to Rick's comment. I do totally agree about the testing. And with sarcoidosis, not only do you want to get the regular D that's in the panel, you also want to get the D1,25. It's a different one. And here, I don't know if everybody has this problem, but it's like pulling teeth to get that test run. And but it's important because one of them is the active vitamin D and one's inactive. So you can look low on the regular vitamin D, but actually be high on the other one, which is what happens a lot in sarcoidosis.
You said it's vitamin C and which other one?
D1,25.
I think that might be the same as the D3 hydroxy 25. I'm wondering if that's the same. Is that different, Susie? Do you know?
I think it's different. So yours is just, I think it's just D20. Oh, let me look. Hold on.
I think they are different. I looked at my chart today and it had like 3 or 4 vitamin Ds on there. So I think they are different.
Okay.
Yeah, so the one is just, oh, now I lost you guys. Oh, here's a red dot. There you are. Okay. The one that you're talking about, Rick, shows up on my labs is just D25.
Okay. So I'm learning. It's great. I'm learning too. But yeah, be sure you get the test for the D and be sure you get the right D. But you know, it's also very smart to test on a regular basis, especially if you're really low when you start and you start taking big doses, then over time you can reduce the amount that you're taking.
Yep.
And still.
It is very true. And along with what both Spencer and Rick are saying, long before I was diagnosed with a sarcoidosis, I went through a pain rehabilitation program at the Mayo Clinic in Rochester, Minnesota. And they had a whole class on what happens when your vitamin D is low. And it actually makes it so you have a lower pain tolerance, so your pain hurts more, and you're more susceptible to depression and a bunch of other things. So yeah, it is important to get it tested. And a lot of people go low in the winter, and especially with everybody staying at home doing everything on the computer, probably a lot more people are low in vitamin D.
Yeah, so you don't get any in the northern hemisphere. You basically don't get vitamin D from the sun from October to March because the sun's too low in the sky. So again, that's another time to be testing, because you don't get anything naturally.
So one of the things about that test, my doctors have been testing me for vitamin D probably for 10 plus years now. They do the blood work, and that goes along with the iron and all the natural blood work that we would get as sarcoid patients. And for those who don't like needles, I found a little trick. It may be helpful to you, it may not. Is right before you get stuck, cough into your elbow. It blocks, for me, it blocks the pain receptors for about a half second, so that when that needle drops in, you don't feel it as much. It's a little trick I've picked up from a couple of the nurses I've talked to at Kaiser Permanente, and it seems to work for me.
Say that again, Spencer. What do you do?
I actually I have the nurse or whoever's doing my blood work dash needles, count down from 3, and right before they get to 1, before they stick me, I actually cough into my elbow just a tiny bit, like just a light kind of thing, and it tends to block the pain receptors. So if you don't like needles, that's one trick I've learned over the several years of dealing with needles and sarcoid.
That is great. I love that, because all the time, and not just in this group, in all the groups, we always hear people complaining about needles. So we're going to use that. Thank you, Spencer.
Good. I'm glad I could share something that was helpful.
Thank you.
Make y'all laugh. Hey, anybody watch The Art of Cuss Words? I'm gonna throw that out there. It does. Yes, Wendy. I'm sitting here and I'm like, well, they say if you just say fuck over and over and over again, your pain tolerance increases by 30 seconds. I'm dead, y'all.
Leah, it cracks. It is so funny. You guys all have to get it. It is so funny.
Really? I can see it in front of all the doctors?
It's worth it.
Yeah, I was in the hospital last week and I said to the doctors, I said, fuck this COVID, fuck this COVID. And they were all like, you can't see through the mask, but they're all.
It really, I don't know, y'all, if somebody needs 4 hours, I don't even think it was 4 hours, Wendy. What was it, like maybe an hour and a half long, 4 episodes on Netflix? It was perfect. It definitely made this one laugh. I would advise it if you need to get through pain.
Yeah, but the amazing part is that they went through, the word, bitch, which is a name of a dog, female dog. There's different names for bitches. And it was just so funny. And they had all these doctors of linguists, and it was just amazing. Just amazing.
So, oh, Rick, were you about to say something? I'll let you go first. Okay,
No. Oh, yes, I am. I'm about to say goodbye, because I got to run over to the other meeting. But as Kathleen knows, I always love to come by and say hello to my Saki friends. And it's great to see you all. And this was a terrific 15 minutes. So I'll see you. I'll try and stop by the next meeting. Bye.
Thank you, Rick.
Bye-bye.
So one of the things that I do, and I find it helpful for me, especially when I go see doctors, is I have this thing called a pain journal, where if I'm feeling something off, I have an ache in my shoulder that's not going away, I'll write it down, and then the date on top of, hey, the pain level was X, Y, Z, and I actually just bring that notebook. It's almost a binder now. And I just bring that to my doctor, and he has that documented every time.
Hi, Spencer. I hope you're feeling better.
I'm feeling all right today.
Guys, I have to go. Thank you. When is the next meeting again, Kathleen?
It's going to be the first Tuesday of next month.
Awesome. Great, guys.
I didn't look up that part. You're throwing me under the bus here.
February 2nd.
Thank you. So February 2nd, there you have. I may not be on that one. I think I have Remicade around that time. So, and but it was nice having you online.
Yeah.
And I
All be safe. Thank you, guys. Take care.
thank you.
Be safe.
Thanks for being here.
So I know, other than Leah, I think we've gotten a hellos to everybody. So I did want to bring up two articles. One that Wendy sent me today, which Wendy, I have read that in its completion, and it's so exciting. So what she sent me, I will put up on the chat in a few minutes, is the monocytes could be a key player in sarcoidosis pathogenesis, a study shows. So that will be very interesting for everybody to read. Get us. Got it. Leah was sending something on the online. And then I think I mentioned this, Susie, last time, but it has hit quite a few of the places. So there's a TNF alpha inhibitor. It's called XTMAB16, has been granted FDA's approval of an orphan drug designation for sarcoidosis. I have sent that indeed to my rheumatologist. I'm going to put both links up in the chat within a minute or so, because I'm going to send it back to Susie. Oh, you know who we didn't say hello, good evening to is Miss Trina, but I will come back to you, Miss Trina, I promise. So sorry about that. So I just finding this very interesting, because one of my thoughts was, and you know, I sit at home all day other than cooking and baking and cleaning and all the other typical stuff and sitting on the couch for hours on end, is I think about these things. So like, for instance, COVID really affects the lungs. It affects a lot of other places. But what is the first thing usually that sarcoidosis hits for most of the patients is lungs. So could this be indeed something in the future that may actually help us? I don't know. But these two are, and the other one that I had mentioned about Brian Young with the Foundation for Sarcoidosis Research, his paper is not out yet. I've been told it should be out in 4 to 6 weeks. If so, I will be sending that, because that's a cardiologist from Yale who's been working with other doctors, and they have found some positivities with Xeljanz. So, but nobody can do anything until we get those. So Susie, if you don't mind, I will put those links up. And Miss Trina, can I say good evening to you, and how are you doing? Are you going to talk to us tonight? Oh, she must have someone in the room. All right, so Susie, I'm going to go back to you.
Okay, so I was thinking, Jaden, I want. Oh,
Hi,
sorry.
everybody.
Go
I
ahead.
was trying to figure this thing out. I'm just in a lot of pain here lately. Just bearing it all and getting up, rolling out 2 hours late for work, hour late for work, and just managing. That's all. No complaints. Just grateful I'm still here, living and breathing, and getting to bond with the grandkids. That's about it.
Well, thank you. We're really glad to have you here, Trina. And Jaden, I felt like I wanted to apologize for being, I don't know, you're being so young and getting diagnosed, and then I'm on here crying about how I can't stand having sarcoidosis. And also to Elizabeth, I mean to everybody actually, but you guys especially, I want to let you know it's not like this for everybody. But usually I have found the people that become advocates and show up to the support groups are the ones that have the chronic systemic issues. But I have people here in our support group in Utah that do like really great. There's this one guy at Humira, and he is the general manager of the aquarium up in Ogden. I don't know, that's way far north of me. And then I don't know, other people manage their sarcoidosis and they have full-time jobs and stuff. That's just not my experience. So I'm hoping that you have a wonderful experience and that you
Susie,
don't have mine.
yeah, right. I mean, Susie, I do have a question though. With neurosarcoid, do you see that a lot?
um, yeah, in the sense that I'm trying to think. I'm wondering, you know that phenomenon where you buy a white truck and then you start seeing white trucks everywhere? I kind of wonder about that with neurosarc because I have it in my peripheral neurological system. And I've met several people that also have it. So I've met a lot of people with neurosarcoidosis, but I think that my view of it may be skewed just because of the people that I've met. I think that it's more rare than it appears to me, if that makes sense.
Yeah, it does. Uh, but I'm not sure. Leo, what is are you there? I don't know. Oh, okay. I thought you left the room. Um, can you like explain exactly what your son has? Does he just have the sarcoid, or is there something else?
So they found the sarcoidosis in the lymph node. So they removed a piece of the lymph node from his neck, which looked like a muscle coming out of the side of the neck. So they removed that and biopsied it. Vanderbilt couldn't diagnose it, so they sent it to the Institute for Health in DC area, and they came back and stated it was undiagnosable, but that there were granulomas present. So it came back to rheumatology at Vanderbilt, and they said that it was sarcoidosis. So that's when they then connected this with his eyes, because he had the lymph node, but then also was centrally blind. So they were trying to tell me that they thought that it was either lymphoma or an infection when they put him in the hospital. So it all happened within a week's time. So they were trying to disconnect the eyes versus the lymph nodes and tell me that they were two different things. So I took them to my husband's TBI doctor on Fort Campbell. And I was like, somebody please, I know her personally. So I'm like, is my son full of shit? And he really, he's just playing me, or can he really not see? And she ended up sending an emergency MRI because she thought that he had a tumor because of the central vision loss that he had. So they're lucky that we got him up there because it was so quick that, I mean, he had so much loss, color loss, that, I mean, the whole nine. And they kept him up there until they could really say that doing IV steroids was going to actually help it come back. So they kept him for a week and then released him with just that. They didn't have no treatment plan, but he started to relapse again, and he started to lose more vision. So as of last couple of weeks, they just put him on the prednisone eye drops, and they have stopped his Humira injections as of yesterday and said not to give them to him anymore because they want to start Remicade, because he constantly has relapses left and right. And he's on weekly Humira injections plus 2 grams of Cellcept. He relapses at 15 milligrams of prednisone all the time. We can't get him lower than that, but they don't want him on the prednisone anymore because all of the side effects that come along with it. But then they throw this in there, and it's like, cataracts is, looking good in his future, and somebody at 70-year-old bouncing back from cataracts normally versus somebody with uveitis bouncing back is totally different. So trying to save his vision and give him the right treatment plan, but yet still let him live a normal life is different. So, but they're also saying because he started projectile vomiting, they sent him in for a scope to make sure that all these meds weren't giving him an ulcer, and they diagnosed him with EOE, which is like an esophagus issue. It's like inflammation of the esophagus. And so as the longest the child has been able to walk, he's always thrown up and made it to the toilet, but he could not. He would literally be on class and he'd just throw up next to him. So he goes back Tuesday to get another scope to see whether or not the omeprazole is helping, because that's what they said to do, is do 40 milligrams of omeprazole twice a day to see if they could keep, keep it under control. But then is the sarcoidosis related to the EOE? Are the migraines that he's having related to the sarcoidosis? Like, trying to connect all these dots and say, just because he's been diagnosed, how much of it actually is related to the sarcoidosis, because they're all so new. He's never had the vision loss like this. He's had regular kid vision loss. He's always had migraines, but they're saying that the prednisone should help to control the migraines if it was related to the sarcoidosis. And does that answer your question, Wendy?
Yeah, you did. You know what? You're a beautiful person, and what you do for your son is just beautiful. And
Thanks.
I think we're all in amaze of you right now.
Oh, hey, I would do it over and over again. Hopefully I know.
So, go ahead. Go ahead, finish. Sorry.
No,
So I can't speak to the EOE, but I can sort of speak to the cataracts and uveitis on my end. I've had it forever. If you find a good eye doctor, that's the biggest thing. One that you can consistently go back to, and they know sarcoid, or at least they're willing to learn sarcoid. That's been a lifesaver. But I was on the prednisone eye drops as well. But since being on Remicade, they don't want me doing the eye drops for prednisone. They do have me on methotrexate, however. I think that's pretty common amongst all of us, is methotrexate. But the cataracts and the uveitis, it can fade and come back pretty regularly. So, as long as your eye doctor's on top of it, he should be fine.
Yeah, but cataracts doesn't go away. I mean, isn't cataracts like a permanent?
They are, yeah.
Yeah.
But the uveitis can sort of fade, and the scarring will be there.
You don't want
my eye doctor. Yeah, no.
So what they're telling me, I mean, he's seeing a retina doctor, and Dr. Kim at the Eye Institute is supposed to be the best of the best. He's a retina doctor, and Jaden relapsed and Dr. Kim was off, and I pretty much was insistent on bringing him back up there. And so they let him see another doctor that works underneath him. And Dr. Kim kind of got mad, and he told everybody that if he is not there and Jaden is having a flare up, that they are to immediately message him, and he is the only person to treat Jaden.
Good.
Wow, that's really good. Dr. Kim, yeah.
Yeah.
Yes,
Go,
but
Dr. Kim.
It also makes me a little nervous because Dr. Kim, he's much different than I'm used to dealing with. As a caregiver, I'm used to dealing with doctors that help me understand what's going on. So I'm a TBI wife, like I got brain injury down packed, and so I'm used to somebody explaining it to me and me learning it and understanding it and being able to dictate it back to you because I understand what it is. And he doesn't have that same bedside manner. He's not that his nationality has anything to do with it, but he's Asian, and he's through and through. It speaks very fast, and he expects me to understand what it is that he says. So his bedside manner kind of cuts me, and I'm like, I don't know how to.
It's just not a male chauvinistic peg.
Well, I mean that. I don't think
doctors are.
He's very he's very knowledgeable. He just rushes through everything and expects me to understand it, so it makes it hard. So I'm like, that's great that he wants to treat Jaden, but you're treating him and I don't know the questions to ask. It's like you guys say, you have to be the advocate, you have to do your own research, you have to do this. And it's like, I don't really understand what it is sometimes that he's telling me. He does these images and he takes pictures of Jaden's eyes, and you should see me in there. I'm like a little, and I'm like videoing and go home and zoom in and record and try to see what it is that he's seeing, because he looks at the images but then doesn't tell me what he sees and what he doesn't see. And then, like, I learned from his rheumatologist just last week when he was talking about changing to the Remicade. He said, he's like, well, I see Dr. Kim said that, you know, he sees something on the front of Jaden's eyes. And I said, see, that's what makes me mad, because Dr. Kim doesn't tell me that. Dr. Kim puts it in his notes and says it, but then he doesn't tell me that he sees anything. He just throws these at me and it's like, hey, well, we're gonna.
It's not good.
And so it's like I'm hearing it from another person, and I'm like, so that's why I say I don't know if that's just, I don't think he's male chauvinistic. I think that's just his demeanor. And I've got that from a lot of just.
Yeah, I had that with my first group of doctors.
Yeah.
And then they all said, and I didn't know anything, you know, until, you know, I got in this group. And they said, well, we don't know anything about sarcoid. You know, they were all like afraid. And then they just sent me over to, you know, rare disease specialists. But like, they were like geniuses, okay? Neurologists are pretty smart. They have to, you know, think your head, you know. But one of them I swore was autistic, but their bedside manner, they were so rude to me. I felt like a piece of, oh, let's say it, shit.
Yeah.
Leah, may I make a suggestion to you? I don't know if you're familiar with, you can get your son's they call it patient's notes at the end of each visit.
There's nothing there.
And then start formulating your questions according to that last visit. Does that make sense?
Yeah, but there's nothing there.
Yeah, sometimes I have doctors and they don't have the note, they don't even write notes.
Yeah, there's nothing there. I can so I've called his person and I'm like his receptionist, and I'm like, hey, there's nothing there. I need to get such and such for the school. So like when I was setting up Spencer for the IEP, I'm getting his 504 changed over to an IEP, and he's like putting in there that Jaden's uveitis is stabilized. And I'm like, if he's so stable, then why are we upping his prednisone? Why is he pouring water from his eyes? He can't hold his eyes open. He's light sensitive. Like, these are things where a stable person would be able to function normal. That would be stabilized. Oh, well, we've got a stable treatment plan, but it's really not, because you're changing his meds. So that's,
you know what you can do, Leah? Call, Trina's onto something though. You can call the office and ask them, I'm sorry to say, but I don't understand the doctor, and this is my son. Can you please have him like explain it to me, or could someone in the office speak to him? They probably can't understand him either.
No, well, that's where I've been kind of reaching out to other people, and like on the sarcoidosis pages, and like Wendy and I met Wendy on one of the pages where it's just kind of,
months ago.
Yeah, it was back in July where, she just kind of sent me a message and I kind of explained stuff back and forth, and we talked a little bit, and I'm picking up bits and pieces, and when I have a question about something, I'm like, hey, who's been on Remicade versus Humira, pros and cons, give it to me, and just what's the best thing that I can do for him. He's nervous about it. He doesn't want to lose his vision. We just had his prescription changed, and in a year, he's gone from a -5 to a -8, in glasses. So he lost significant amount just with that, with one lapse, or what, I don't know what you want to call it. So I don't know. I'm trying to keep him from being nervous about it, making sure he's in therapy. But now I also have to turn around and explain it to my husband, who has brain injury. So trying to explain it to him and get him to understand, and Jaden falling out about not being able to communicate what's going on with him and having fits or tantrums. It's like, I don't.
So Leah,
are you able to get a social worker for your child, for your son? While you there at the, I don't know if you're going to the clinic or are you going to a private physician?
No, this is military.
No. He's the military. Not seeing him right now. His PCM is through the military, but he's at Vanderbilt. All his providers are at Vanderbilt. His neurologist, his rheumatologist, his
Are they having these conversations about him? Are they talking with each other, or are they just talking directly to you?
They're supposed to be talking to each other, the rheumatologist and the eye doctor. So the ophthalmologist and the rheumatologist, they joined together to say that they were going to do the Remicade. So between the two of them, now whether or not they've talked to the rheumatologist or not, not the rheumatologist, but the neurologist, I'm not 100% sure, because she's put him on Topamax for the migraines that he's been having. So, and the Topamax has helped like greatly. Now, but then I get a message from hey, Jaden, stop. I get a message from the pharmacist that's like, hey, put him on folic acid because this stuff has got to be damaging his cells. Like he's on all these things right now,
Yeah, you know what, Leah? I was on the Topamax too with the Remicade. It was not a good thing. I dried out real fast. I was drinking gallons of water, and having severe headaches.
Yeah,
I actually had to quit Topamax after just taking it for 2 days because it was hurting my stomach so bad.
So he had stomach pains too, but that part of it seemed to just kind of.
They have alternatives to the Topamax.
But he's not having any migraines, and he's actually able to get online and do schoolwork, because that's, that was the other thing where it was like he was down for days with the migraines. And it's like at some point he still has to catch up in his schoolwork because, it's like you're literally standing there. If you're not beating one bush, you're beating the next bush. Because whether he does it or I do it or it doesn't get done, one way he's still got to get through school. You know what I'm saying? And he's a high schooler at that. So there's just a lot of moving pieces, I guess. I don't, it's no woe is me or woe is him. It's how are we going to get through this? What's the next step? So
I suggest you get a case manager if it's at all possible at the hospital.
Leah,
help kind of coordinate things and making sure that these physicians are having these discussions with each other.
Okay. Yeah, I'll definitely
the other thing I would recommend possibly is if it's
also,
trouble with schoolwork.
When you leave the doctor, before you leave his office,
Oh yeah, she's probably saying ask them to get notes from what happened in the office.
Yeah.
Right, Yvonne?
So, but about the schoolwork thing, what I would recommend is get in touch with all his teachers and have them email you any classwork or homework, and you can possibly print it out. That's what my teachers did when I was in high school and middle school and elementary school. They would send it via email, and I would just do it that day and then turn it right back to them pretty much same day.
Yvonne, you're on two things, so it's hard to hear you because you're on two signals, and you're on three, actually, 4.
Oh yeah.
Yeah, Yvonne, I think her Wi-Fi is slow in that area.
He's got 4 of them on, and it's just you're coming like in and out.
I think we're out of time and we need to wrap up, you guys. I'm sorry.
No, you're good.
It's all good.
You guys very much. Spencer, thank you for all your help, and everybody for your advice.
Oh, boy, you're you know what? You have a wonderful mother that loves you so much. And you have such a beautiful smile. I hope I can meet you someday. Maybe I can come to Tennessee someday and visit you.
And this goes for everybody, day or night. If you need to reach out to somebody for advice or whatever, Facebook is the quickest way to get to me. Just send me a message, hey, I'm going through this, and I will give you the best advice that I can and how I would deal with it. But other than that, have a good night, everybody.
Thank you, Spencer.
Yeah, thank you, Spencer.
And Leah,
thank you, Elizabeth. I hope you come back.
Leah, I will find you because I also have people who are in your area and at Fort Campbell.
Oh, sweet. Yeah,
And,
like sarcoidosis people?
no, in the medical field by you.
Ooh, at Bach?
Yeah.
Oh,
So
okay.
I'm going to find you, and I sent you my phone number too, so you can always reach out to me.
Okay, perfect. It's in the chat. Oh, okay.
Yes.
Yes.
Okay.
All right.
Take your
Yeah.
time. I'm not going to shoot everybody out of here. Yvonne, are you still with me? I think she is.
I
Yvonne,
see
can you
her
stay?
face.
Yvonne, could you stay for a few minutes?
All right. Thank you, Susie.
You are welcome, Leah. Thanks for coming.
Bye, Leah.
Bye, guys. Thanks.
Bye.
Bye.
I'm just going to dismiss anybody who hasn't been in. Excellent. Hi, Yvonne. So I know your, I guess Wi-Fi or whatever is a little slow there. So I don't know if you have a computer one day, but if you do, and maybe if you and I could find some time just for the two of us, or even if Susie's at home and feeling better. She wasn't feeling well today, but I knew you were coming on, so I wanted to be there with you.
Here.
And, so,
I'm here.
yeah.
Yes.
So maybe one day when you, can you
Bye.
get on a computer? Okay.
Bye.
So,
Look at you.
so I think one day if you can, maybe the three of us can come on and I can show you the
I don't know what's
chat
going on.
and Susie can help you because this is not scary as you see. You know, I think the scariest part always for me is coming on and, oh my God, who's going to be there?
Okay. If she,
So,
whatever day you want, I'm available.
okay. So I'll
Available
work.
anytime.
I know Susie's not feeling well, and Susie,
Yeah.
thank you so
Yeah.
much. And I forgot to thank you with everybody there. I apologize.
That's
And
okay.
actually,
You're welcome.
hold on. Guess what else